Welcome back. We are tackling colon cancer today. Dr. Mohammed Faizan Ahmed with Cone Health Rockingham Gastroenterology at South Main is here to talk about the cancer and the importance of screenings. You know, we've talked, Doctor, a little bit about some of the different screenings, the different things you can do. I'm wondering whether I had heard that there was a blood test that was going to be available. Is it available yet? And if not, do you know when it will be?
So there's definitely different kinds of screening modalities, meaning screening tests for colon cancer. But the general rule is the best screening test is the one which gets done. So there are many patients who won't be ready for colonoscopy. So there is stool-based testing, blood-based testing. So what they do, for example, the stool-based testing, it detects microscopic blood or abnormal DNA in the stool. And similarly, this blood-based testing is available. But if they are positive, then the next step would be colonoscopy anyways.
We know that you see a lot of commercials for those at-home tests. How reliable are those, and would you recommend one?
So there is different types of tests. There is FIT test and there's Cologuard. Uh, you know, they're great in detecting colon cancer, but still they have less than 50% sensitivity for detecting small and also advanced polyps. So they can detect colon cancer, but they can miss the polyps, and that's why colonoscopy remains gold standard. But again, the best test is the one which gets done.
We were talking a little bit before about symptoms. Can you share some other symptoms that we should really watch out for around, especially in that age range?
Right. So this is the problem. Colon cancer is a very silent disease. It only manifests most of the time when the disease is advanced, which we don't want. So the symptoms could be such as if someone's seeing blood in the stool. And unfortunately, I see this all the time where patients would come and they would say, "Hey, it's my hemorrhoids," and unfortunately, I would find a colon cancer there. It could be change in bowel habits. For example, someone was regular all their life, having a good bowel movement every day, but now their bowel movements are more different. They are having a bowel movement every 2 to 3 days. Persistent abdominal pain, and also importantly, having iron deficiency anemia. If someone is anemic, it's important to find out why they're anemic rather just popping iron pills.
A lot of people will, hear the doom and gloom of this, but what is the opposite side of this? How do you live a colon healthy diet?
So diet does play a major role. Um, Having our gut or our colon loves high fiber diet. So eating things like vegetables, fruits. I always tell my patients 2 kiwi a day keeps a GI doctor away because it has a lot of fiber. So eating anything which has high fiber, such as grains, also seeds, is very good for our colon. Also, it's important to limit processed food and red meat. I tell my patients it's important that you should try to avoid things which are packaged. And if you have to eat something, look at the ingredient. The rule of thumb is if it has more than 5 ingredients, you should be avoiding it.
Interesting. Okay. Is there a common misconception that you hear about colon cancer or colonoscopies that you'd like to clear up?
Right. So one of the misconception is, I feel great. Why do I need to have some sort of screening done? As I said, colon cancer only manifests usually when it has progress, and we see from data colon cancer is only increasing. It's the second most common cause of cancer-related death, so it's important to get screened. About colonoscopy, I see this all the time where patients would think that I'm going to go through a surgery. It's not a surgery, it's a procedure where we do it as an outpatient. You are sedated well, we do the procedure, it's a checkup, and then you go home the same day.
An important procedure for sure. Dr. Ahmed, thank you so much for joining us today. We really do appreciate it. And you probably know WFMY News 2's Julie Luck will be raising awareness about colon cancer later this month. As you know, she is a stage 3 colon cancer survivor. She'll be emceeing the Get Your Rear in Gear 5K in Winston-Salem. The walk run raises awareness for colorectal cancer and raises money for screenings. It's at Jamison Park on Saturday, March 28th, starting at 9 a.m.